Good morning, colleagues. We'll commence in the next 2 minutes. Please bear with us. We're waiting for all our panelists and guests to join us. Thank you.
Coming in on the scene itself is Goodwood and Dorchester Road. Peter Johnson with me. I'll have some more traffic updates for you throughout the show. Spot the traffic. Io stiamo lavorando con una cultura comunque molto precisa e vai dove quella quindi tu baka fana to ga rajo na dawo fana ko je ni ta ku shara to la ka ko ni what all right what are you
Good morning, colleagues. I think we need to commence. It's now 8 minutes past 10. So, colleagues, distinguished guests, ladies and gentlemen, a very good morning to you all. My name is Linda Naidu, and I am from the United Nations Office on Drugs and Crime, Regional Office for Southern Africa. Thank you so much for responding to our invitation and taking the time to enhance this webinar with your valuable attention. We look forward to a rich and vibrant discussion grounded in experience and insight. With that, I'd like to bring to your attention some basic ground rules, and which have become now most common to online webinars. We recommend that you mute your microphone and switch off your camera to improve the quality of the audio. Panelists, please turn on your camera and microphone when presenting. Questions and comments from the participants are welcome during the webinar and can be entered in the chat, but all will be answered at the end of the webinar upon the conclusion of all the presentations. We also have an appraisal form that we would like you to complete, which I will post in the chat. It helps to ascertain your viewpoints and recommendations, so please find time during the webinar to complete this form. So within the framework, the 16 days of activism, UNODC has organized a series of webinars to discuss what action may be taken to ensure that the rights of women who use drugs are respected and their access to health, social, legal services is provided without discrimination. Gender-based violence is reportedly higher among women who use drugs. Some studies show that women who use drugs have a 2 to 5 times higher prevalence of gender-based violence than women who do not use drugs in the general population. So the purpose for today's webinar is to present the findings, recommendations of the study on the needs of women who use drugs, increase awareness on the violations of the rights of women who use drugs, discuss opportunities and actions to improve access to services for women who use drugs. Today's webinar presents a joint effort to recognize and address the particular needs and rights of women who use drugs, and to make recommendations for the next steps in addressing those needs and rights. I will now hand over to Ms. Zulish Akisheva to officially welcome you. Ms. Zulish Akisheva is a representative for the United Nations Office on Drugs and Crime, Regional Office for Southern Africa. She oversees the UNODC portfolio in all SADC countries under the framework of the UNODC SADC regional program, making the SADC community safer from drugs, crime, and terrorism. Ms. Akisheva has more than 20 years of extensive experience in multilateral cooperation and international development across Asia and Africa. Prior to joining the regional office, she served as the UNODC country manager in Vietnam between 2010 and 2015. She was the head of the UNODC program office in Kyrgyzstan in 2008 to 2010. She was a deputy regional representative at the UNODC regional office for Central Asia between 2004 to 2008. She also worked at UNODC headquarters in Vienna at different posts. Between 2000 and 2004, she's a holder of several senior level diplomatic assignments and is my boss. So over to you, Ms. Akisheva.
Thank you very much, Linda.
Okay.
Linda? Hello?
Hi, Zulish, we can hear you, but very faintly. And I think the sound has been removed. Thank you, Zulish.
Okay.
You can go ahead.
Okay, thank you very much. And thank you very much, Linda, for such an extensive presentation of me. I'm very humbled, actually, by this presentation. But let me start by welcoming Henrietta Bakapane Zulu, Deputy Minister, Department of Social Development. I'm also honored to welcome Angela McBride, Director, South African Network of People Who Use Drugs, Lillian Mashele, Acting Director, Policy Development and Research, Civilian Secretariat for Police Services, Colonel Matlamela, South African Police, Pierre Smith, Acting Head of the Sexual Offences Unit, National Prosecution Authority. So today we join for a discussion on a very important topic, which is the experiences and challenges faced by the women who use drugs in South Africa. But before going to the discussion, let me start with setting up a broader international context to the focused discussion we are aiming at having today. Let me start by referring to the World Drug Report, which was released by UNODC in June this year. According to the World Drug Report, more than 250 million people worldwide use drugs. Over the period of 2009 and 2018, the estimated number drug use increased from 210 to 269 million. In other words, by more than a quarter. This is partly due to the growth in global population. However, it also demonstrates the overall trend in increase in drug use worldwide, with over 35 million people suffering from drug use disorders. Whereas the international community calls for enhanced measures to address illicit drug trafficking, the drug use disorders are considered to be a health issue. The reason that I'm setting such an international global context is for all of us to realize that it is a problem that will stay with us for many years to come. This is a problem that we will need to address collectively, both at the global, regional, and a country level. Let me also refer to the special session of the 2016 UN General Assembly on the World Drug Problem, where all UN member states, including South Africa government, agreed on a joint commitment to effectively addressing and countering the world drug problem. For example, in discussing the issues of drugs and human rights, youth, women, children, vulnerable members of society, the member states committed to mainstream a gender perspective into and ensure the involvement of women in all stages of the development, implementation, monitoring, and evaluation of drug policies and programs, develop and disseminate gender-sensitive and age-appropriate measures that take into account the specific needs and circumstances faced by women and girls, in line with the UN Convention on the Elimination of All Forms of Discrimination against Women. Member states agreed to ensure non-discriminatory access to health, care, and social services in prevention, primary care, and treatment programs, including those offered to persons in prisons and pretrial detention centers, which are to be on a level equal to those available in the community, and ensure that women, including detained women, have access to adequate health services and counseling. Indeed, women drug users constitute a significant group among the drug-using community, but world over they remain largely hidden population. Women who use drugs are a neglected, almost invisible group in most places in the world. Since male drug users generally outnumber women, women who use drugs are often overlooked in research and frequently ignored in programs serving men who use drugs. The assumption is that women who use drugs will find a way to fit into the drug program for men and get their needs met somehow, as women do in so many other areas of life. But experience shows that instead, women who use drugs tend to fall through the cracks in male drug programs. They hide, cannot be contacted by the program, come on time to a drop-in centers or some program activities and never return, or simply refuse to come at all. Drug programs designed for men simply don't meet women's needs. We have different problems and needs which must be addressed by initiatives specifically tailored to them. Research shows that women drug users face more discrimination and stigma from society than men. They are also at risk of transferring their physical problems to the next generation through babies that are born premature, underweight, often unplanned, and sometimes born addicted to drugs. COVID-19 crisis has further exacerbated the current situation, since many women who use drugs are homeless, with limited or no access to social relief measures. The more difficult situation of women who use drugs makes strategic intelligence programmatic response imperative, and this calls for attention to pioneering programs that offer gender-responsive, comprehensive drug prevention and care to women. Such programs should introduce innovative work approaches with women who use drugs, women who inject drugs, female prisoners, many of whom are also using drugs, and women living with HIV and AIDS. There are programs which have been developed and tested in many countries of the world. So there is a solid evidence of what works and what doesn't work. The experience generated in implementation of these programs worldwide are allowed to identify essential principles of effective programming for women drug users. These principles include investment in the regional research to increase understanding of drug use among women. It is often possible to include questions regarding women who use drugs in national health studies or behavioral surveys that may be planned or done regularly by national authorities. Ensure that drop-in centers are shame-free zones with which women are comfortable to visit. Encourage and support community organizations run by women drug users. Ensure access to needles and syringes to women who inject drugs. Include psychosocial care as part of the initiative to address violence faced by these women. Recognize the link between drug use and sex work and therefore reach out to this group of women as well. Work closely with prison authorities to improve health and the social conditions of women prisoners. Many of them are there for drug-related offenses. And of course, provide shelter and empower women living with HIV. We know that addressing the gender-based violence is a high national priority in South Africa. It is also a personal commitment of President Ramaphosa to address the specific needs of women and in countering the violence against them. We also applaud a lot of positive development in the country, including the recent launch of the National Drug Master Plan. But I think it's very, very important to see how the national measures against the gender-based violence and how the national measures as a follow-up to the adoption of national drug plan actually contribute to the well-being and specific needs of women who use drugs. For this reason, I welcome participation at the webinar today. This is the first webinar that we organize jointly with Sanput and with the DSD to see what are the challenges or gaps or obstacles that different service providers see in addressing specific needs of women who use drugs. With that, I wish all the participants to have a very fruitful and a very constructive focused discussion so that we come up with some recommendations that we can try to follow up on. Thank you very much for your attention. Linda, over to you.
Thank you very much, Ms. Akisheva, for opening today's session and also providing a context for today's webinar. And I think you raised a very valuable point. How do the national measures contribute to the particular needs of women who use drugs? And I think that's really important in how we address that today, because indeed women who use drugs are more heavily stigmatized, as well as being frequently ignored, invisibilized, and sidelined in the formation of policy and approaches to service provision. So having said that, the presentations for this webinar is compartmentalized into two themes. The first being integrating research in policies and strategies and how we can determine the next steps. And for this thematic area, we have three presentations. We commence with our keynote speaker for today's webinar, a person who needs no introduction, the Honorable Deputy Minister, Ms. Hendrietta Bogopane Zulu, the Deputy Minister of Social Development of South Africa. DM, we are really humbled by your attendance. Just a brief profile, and generally her profile is extensive. She's an amazing woman. In January 1996, she was employed by the Disabled People South Africa as the National Coordinator for Disabled Women's Development Program. She has served as a Member of Parliament for 4 terms. In that period, she was appointed as the Chairperson of the Joint Standing Committee on Youth, Children and People with Disabilities, to the Portfolio Committee on Social Development, the Deputy Minister for Public Works, the Deputy Minister of Women, Children and Disability and People with Disabilities, and Deputy Minister of Social Development. In May 2019, she was reappointed as a Deputy Minister of Social Development. She championed various ground-breaking initiatives and activities, which include, but not limited to, being the chairperson of the Inter-Parliamentary Union Advisory Group on HIV and AIDS, UNAIDS Review Committee, the co-chair for the UN Agenda for Women and Girls on HIV and AIDS, the chair of the AU Specialized Technical Committee on Health, Population and Drug Control. So a specialist amongst us people. DM, it's an honor to have you contribute to this webinar. We now hand over to you to speak and present on the Drug Master Plan. Thank you.
Good morning. Yeah, I felt like I'm attending my funeral 100 times. So every time I'm introduced, I feel like it's my obituary being read. Let me acknowledge my dear sister Zoldish. Thank you so much for putting this together. And let me acknowledge all of the South African National Police Service, all of the different speakers, the NPA, our non-governmental organizations, and women who use drugs themselves, as well as the South African network of people who use drugs. You most acknowledged and welcomed, and thank you so much for the invitation. I think there's been so much said about South Africa's Drug Master Plan, and we learn every day about it as much as we wrote it, led it, and made sure it's approved. It's a revolving document that tries to highlight what is it that South Africa is supposed to be doing and how South Africa is supposed to do what it's supposed to do. It's the most progressive, but yet there's still a lot that needs to be done. And like any other document, it's a consensus document. But we're happy with where we've been because that's the 4th master plan, and it slowly we're beginning to actually be in line and in sync with what the UNODC prescribes at an international level, but also building in the political commitment as well as the political declaration from both the special session on drugs in New York, but as well as the Africa Common Position, which we had the honor and privilege to lead and to write and to represent and lead Africa during that critical time. We're beginning to also see a lot of change and a lot of dialogue towards the African Union Drug Master Plan, and that humbles us a lot because it keeps saying there's a lot of work and we need to change policy to begin to accommodate and acknowledge the challenges. When one talks about women, I think before I even get into the issues around women who use drugs, you're talking about a very complicated human being, one that's mastered the art of wearing a mask, one that's mastered the art of singing when they are hurting, pain, and give of themselves more than they receive back. And I think that is what I want to focus on in terms of women. We're going towards the 16 days of no violence against women, a day before the UN Day for Men. So the 19th of November, where we would take the opportunity to host the men in Parliament, and to actually make sure that we can talk about, amongst other things, issues that affect women. One of the most painful things for me working in the space and also being the department that provides rehabilitation facilities and services, as well as the registration of drug rehab facilities, both private and public, the kind of programs that are being given. I want to agree with Zoldish that the truth of the matter is half the time, if not all the time, women are expected to be in a space that was never designed for them. And that is also part of what we are championing and pushing to change in our own drug rehab facilities. Women find themselves addicted to drugs and alcohol as a coping mechanism most of the time, to be able to deal with the abuse, both physical, financial, the self, to just pick up, because stigma tends to be higher when it comes to women. But our facilities are not responsive to the needs of women, because part of what we can confirm as a department is that we don't have a lot of women reaching out for assistance or reaching out to utilize drug rehab facilities for the reasons that UNODC has already outlined. The stigma is much higher. Women are always expected to be holier than thou. Women are not expected to actually be addicted to drugs because society has decided what kind of an image of a woman they want to have. One of the challenges is that when women are addicted to drugs, sometimes the social development in the silo mentality of how we develop policy, the first thing that happens is the women who is addicted to drugs, the first move social development does is to remove their children. So you end up women who use being unable to reach out for help, hiding because they don't want social development to put their children on foster care. That we are dealing with and addressing and changing, especially since the World Drug Women Who Use Drug report that the UNDC commissioned. That is one of the things that we are changing to make sure that women who use drugs don't just lose their children and social workers removing their children by virtue of them reaching out for help, so that we open up the space for more women to actually reach for help. But we're also making sure that we renovate some of our rehabilitation centers, especially the new ones that we are building, to also accommodate mother and child. Because unless we know and unless we are given the assurance that we can be able to look after our children while we are getting the much needed rehabilitation, that would make sure that more women reach out for help. So we're reviewing our policies on families so that we are able to actually provide better services for women who find themselves using drugs. The other area is that we've experienced women overdose a lot. And we don't have the guidelines on overdose in our facilities. And for the first time, we hosted acknowledged the overdose day, but it established a training to train our service providers to understand that not everybody that overdoses is going to die. And what is it that they need to do, and the having overdose strategies being visible through everywhere so that there can be a better support. Women need sisterhood, because as women, we grow in drawing strength from others. And at the moment, our services are not actually geared to allow the sisterhood to continue and not necessarily be isolated. But a lot of children are also introduced to drugs by women who happens to be their mothers, not talking to the issue around women who use drugs and they are pregnant and give birth to children who are already addicted to drugs. But we do have experiences which are growing where women who are mothers who use drugs are introducing drugs to their children, because at that time she's too high to be bothered by a hungry child. She's too high to be bothered by cooking for that child, and they look at the easiest way to actually silence that child, and the children end up being addicted to drugs. We need to also look at the issue and the contribution of drugs on issues of trafficking and the issues around sex work, because that space, as much as men are there, but women are the majority. The role drugs actually play for women who are sex workers. And as we work towards decriminalization of sex work, we cannot separate how we are going to deal with issues of decriminalization and the contribution of drugs in that space. And that is part of what we are busy with as a department, in partnership with justice and police and the security cluster as a whole, to say we're working towards decriminalizing sex work, but how are we going to deal with the illicit economy in terms of the flowing of drugs within the sex work space? And how do we empower women with the right information so that they are able to make better choices? And also, as we finalize and amend, but also finalize the policy on services to victims of gender-based violence and femicide, we also need to make sure that as we talk about GBV, we also never lose the fact that because of the abuse women experience, they end up using drugs to cope. As I wrap up, obviously, HIV remains one of South Africa's biggest challenges, and drugs, as well as the high prevalence, because HIV still shows the face of a woman. Now, you cannot deal with any of these without the other. We want to deal with issues of access to substitution therapy. But the next question is, are women going to be able to go to those care facilities? If they go there, would they experience less stigma Do we utilize inpatient facilities, community-based or day patient facilities? And these are all the realities that makes us appreciate webinars such as these ones, because they award us an opportunity to share experiences, but to also evaluate whether what we are planning or implementing currently is in the right way and will it actually benefit not only South African women, but women in general. Drugs remain a challenge. It drives gangsterism, dismantles families, steals the future of young people and now children. But the human rights of those who use drugs remains at the core of everything we want to do. The fact that women are the givers of life cannot be underestimated. So as we discuss prevention strategies, we never should forget that we must have prevention programs that are specifically focused on women, but that create the space for women to be able to reach out for help, deal with the stigma, and at the same time, be the mothers, the grandmothers, the sisters, the aunts, to the many, many, many other generations of South Africa. When we empower women and acknowledge that women who use drugs requires additional support than their male counterparts, then we can be rest assured that our prevention strategies will definitely be a success, because as we say, when you teach a woman, you teach a nation. So let's spend money in educating women on drugs so that they are able to easily pass on, and our prevention strategies and our human rights programs will be definitely affirmed and will be passed on from one generation to the other. Thank you very much.
Thank you, Deputy Minister, for that very deep insight and reflections on the particular needs of women who use drugs and the gaps in services that need to be addressed. I think also it was important to appreciate that the reflections on the intersection between gender-based violence, trafficking, HIV, and decriminalizing, sex work and the use of drugs, and taking cognizance of the context of women and the stigma that generally embraces them, which actually inhibits them from actually responding to services. So thank you for those very, very deep insights. Our next panelist is Ms. Angela McBride. She is the director of the South African Network of People Who Use Drugs and a UNODC partner. Angela will present on the key findings of the needs assessment conducted in partnership with UNODC in 2019. Over to you, Ms. McBride.
Thank you so much, Linda, and thank you so much to our Deputy Minister, as well as Lillian and Signy and UNODC team for making this possible, and of course to the rest of the panelists and all the attendees. I'm going to turn my camera off so that I can share this presentation if it's going to work, which I don't think it's working right now.
We see it, Angela. Thank you.
Fabulous. So in 2018, UNODC supported 4 consultation groups in Johannesburg, Pretoria, Cape Town, and Durban. We met with some incredible women who were willing and able and excited to share their experiences, even though said experiences were... Is it still working?
No, we just lost the presentation. Will you try again? Oh, now it's back on. Thanks, Angela. It's back on.
Sorry, I'm not used to Microsoft Teams, so it's a little bit of a challenge for me. Yeah, so we met with some incredible humans and had some really deep, really challenging, but also quite fruitful discussions, because we didn't just focus on what is wrong and what challenges we have, but we also discussed our solutions and how we would like these challenges to be rectified, but also how they can be addressed. Just a trigger warning, our findings and the information that came forward is raw. It's brutal, it's harsh, but it's also a reality. It's the reality. It's the reality that us as women who use drugs face. Women who use drugs who are homeless, who are also sex workers, they're at higher risk of the criminalization that they experience, and also because of the lack of a safe space, as well as services to access in order to be better supported. These slides are quotations, are input, and come directly from our community. I won't speak too much of them because I feel and I know that their words are more important than anything I have to say. In Durban, Michelle, who's 42, spoke about how they have dehumanized us, and people know it. That's why they, being society, feel like they can look at us like we're animals. Women who use drugs are women first. We are human. The fact that we use drugs, or that we may be sex workers, or we may behave differently to what is expected of us, does not make us any less human, does not make us animals. However, the criminalization of our body autonomy, the fact that we choose to use drugs, or the fact that we choose to be a sex worker, that is a problem. Criminalization takes an already vulnerable group and pushes us further into a hole of alienation. In addition, it increases our vulnerability because we aren't open and able to access services that others may be able to, because of the stigma and discrimination attached to being a person who uses drugs. One of the key findings of the 4 that we'll discuss today was violence, control, and extortion. Fifi in Durban spoke about how the trusted men in blue took the little bit of self-esteem that I had when he sexually harassed me. I've lost trust in the men of peace. The challenge of violence, control, and extortion comes from multiple players. This can be people in uniform. This can be from partners. Ultimately, it is a pattern. Ultimately, it is a regular experience. However, it's not just physical violence that we experience. It's not just control on a physical level, or extortion and bribery. There's also the element of emotional and psychological abuse. Mama H in Durban spoke about when she was 8 months pregnant, they, being the security, came to Greyville where I was sleeping. I was urinating under the tree because the baby was heavy on my bladder. It's important to acknowledge as well that ablution facilities are not available at night. There is no space for people to shower. There is no space for people to go to the toilet, because most of the public toilets are locked at night. This is obviously problematic and unhygienic to us as people who don't have the access that others do if they are housed. Continuing on what Mama H says, the security took a baton and beat me with it on my head. I was bleeding. I followed him to the car and told his colleagues what he did to me. They said I was lying, and they laughed and drove away. There is no recourse, and there's little regard for us as a community, such as when attempting to access or go and open a case at the police station and being told, were you really raped or did you just not get paid? When you attempt to open a case, and like Starlight spoke about it, saying even when I had a case, the police made fun of me and laughed at me. We're blamed for harms that are inflicted on us because of what we choose to do, because we've been discouraged and pushed aside and not given an opportunity to be supported. Women use drugs and people use drugs in general. We want to live. We're humans. We care about ourselves. We care about our family, our children, our health. And we see, and this can be seen when people do attempt to access medication and medical support. Sneh in Durban spoke about how when she went to the hospital to take ARVs, the Metro Police came and took our bags. I tell them my ARVs are in there and they say fuck off. So I think that if I go take my ARVs again, the police will just take it again. And that is the cycle. There is an attempt to access healthcare services. Medication can be collected and taken home, be it ARVs, TB treatments, hepatitis C treatments, methadone and OST. The issue is, where does she go with it? Where do I go if I don't live in a home, if I don't have that option? People want to look after themselves. We do care. We're not robots and we're not animals. But how do you care for yourself if everyone else is going against you? If there are barriers in place that are challenging and getting in the way of you looking after yourself? I reiterate the discussion around healthcare services, because Bisto in Johannesburg spoke about, I once went to a clinic with an STI. When I got there, the nurse who attended to me started asking me how I got the STI. And then she started calling me names. She also called other nurses to come and see me because I'm a bitch. And I always come with an STI because I'm a prostitute. Even if healthcare services are accessible, there is a need for medical professionals to stick to their word, stick to the ethical process, which is no judgment, which is supporting and treating someone no matter who they are, where they come from, what they put into their bodies, what they choose to put into their bodies, whether they eat, whether they don't, whether they are black, yellow, green, white. That should not be a factor, but it is. Being exposed continuously to negative comments, judgment, harmful words, people begin to self-stigmatize and self-sabotage. And when I say self-sabotage, I don't mean harm. Yes, that may be a point, but it's also self-sabotage by not accessing harm reduction services, not accessing health services. Because why would you keep going back to a healthcare facility if every time you do, you get called names, you get told it's your fault? Where would you go? It's been quite a bit of real challenges, raw challenges. And I don't want to speak too much of that because there's also been so much positive that came out, so many incredible recommendations that we as women have. Yes, we need to acknowledge the challenges, but we also need our voices to be heard. We need to be acknowledged. Don't tell us what we need, allow us to tell you. And this is why is a lovely series of webinars that are going to come up, because it's encouraging discussion on how we can be heard and how service providers can integrate our input into services which are meant to support us. Our response and our support should be driven by human rights. We should be holding those accountable regardless of their status and profession. For example, when someone is sexually harassed by a law enforcement officer, that human being should feel safe enough to go and report that without fear of reprisal, without fear of A, being laughed at, or B, later being harmed further because of that statement. Our approach needs to be evidence-based. There is a wealth of information available of incredibly successful programs across the world, like in Portugal and Amsterdam. We need to learn from those, learn how their programs, their support structures influence and impact not only people who use drugs, but society, their entire society in general. We need to look at harm minimization. So drug policy revision, scale up of needle syringe services, opiate substitution therapy, overdose prevention, and safe spaces for women who use drugs. When it comes to working with people who use drugs and funders, we need to be looking at a qualitative approach and move away from target-driven reporting. It's easy to hand out 1,000 needles and syringes in one day to 1,000 men, because men, as previously mentioned, are easier to access. Men who inject drugs are more open versus women who inject drugs who may not necessarily feel comfortable enough. So we need to move away from handing out 1,000 needles and syringes and move towards having a conversation with each person. Instead of it being 1,000 in one day, we should be looking at 1,000 in 1 year and ensuring that those 1,000 people are happy, are safe, are comfortable. We need to educate and hold our service providers accountable. This is from, yet again, healthcare providers to harm reduction service providers, and ensuring that what they're doing is healthy, is safe, and ethical. This includes reviewing our current systems like rehabilitation centers. We need to be reviewing each rehabilitation center in the country and ensure that their program, their policies are ethical, are in line with National Strategic Plan, as well as any other evidence that goes against and that proves the healthier option, the safer option. We should have ongoing community use.
The issue is maybe you might come across a caregiver who's abusing drugs.
Mute yourself.
Hi, can you put yourself on mute, please?
Hi, colleagues, please, can you mute your mics?
There needs to be ongoing community review. When I speak of ongoing community review, I mean nothing for us without us. There needs to be client-centered service, shaping interventions and treatments according to the client. As mentioned by our DM, services are very rarely designed for women who use drugs. Women who use drugs are usually expected to fit in a box that is already there. Trying to fit any human being into the same box is not realistic, and that's in general. We need to be able to take all of these comments, all of these responses, all of these recommendations, and bring them together. And hopefully that's what we can do over the next few months with these webinars. In short, our healthcare services need to be harm reduction, or include harm reduction, OST, and evidence-based rehabilitation. We need to ensure our medical services are effective and sensitized, and we need to make psychosocial services available to anyone and everyone who needs it. We need to ensure safe spaces are made available, drop-in centers, and encourage women who use drugs network groups to form and strengthen. And last but not least, we need to go back to basics and look at our systems. How can we support people to meet their basic human needs, like a shower or a toilet? In closing, I'd like to leave you with a poem written by one of our participants. She speaks about the hardest job, it seems, is to just make a start. Even when desire is strong, this is always the toughest part. You put off things that should be done. You wrestle with fear and doubt. But the only way your ship comes in is once you send it out. The time to do it is always now. You can't have a doubting heart. So once the first has begun, the things you thought you couldn't do have already been halfway done. Thank you.
Thank you, Angela, for your presentation. That was really heart-wrenching. Again, it provides an in-depth overview of the lived experiences of women who use drugs. It also highlights that and recognizes women who use drugs are the experts in their own lives and the critical need to address the unique challenges that face them. Thank you. Moving on to our next panelist, who is Ms. Lillian Mashela. She is the Acting Director of Policy Development at the Civil Secretariat for Police Service. She manages the policy development process on policing, which is geared at contributing to effective and professional policing and ensuring the police reach their long-term goal and vision of a safer South Africa. Lillian's accomplishments include contributing in the development of the white paper on the policing and the white paper on safety and security, as well as other policies and research projects spanning the JCPS cluster of particular relevance, is the development of the policy on reducing barriers to reporting gender-based violence in collaboration. Before joining government, Ms. Mashela worked for civil society supporting research processes around issues of policing, crime, and safety. She will speak to the policy considerations on reducing barriers to the reporting of sexual offences and domestic violence. Thank you, Ms. Mashela. Over to you.
Thank you, Linda. Firstly, perhaps let me acknowledge and thank Ms. Zuldich and her team, yourself as well, Linda, for having me and just putting together such a much needed webinar. I'd also like to, and I'm quite honored to be preceded by the Deputy Minister and the likes of Ms. Angela McBride, and to be with such an esteemed panel, including Colonel Matlamela, as well as Advocate Pierce Smith. I don't know if you can presentation. I am often known to be technologically challenged. Is it up?
Not as yet, Lillian.
You don't see it?
No. Try again,
okay,
please.
So let me try again. So I have shared. Let's share again. Otherwise, I don't know if Obakeng would be able to then share it for me. If it's not visible, is it visible now?
No, not as yet. Obakeng, can you assist, please? I see.
Nothing.
No, yeah, it's coming. No, it is
Okay.
here. You see it. Thank you. Thank you.
Excellent.
It's here at last. It takes some time.
Okay. So once again, thank you, colleagues, and thank you for everyone who's actually in attendance and participating in this webinar. I must just perhaps thank my preceding speakers who've really, as you've mentioned, contextualized the daily challenges faced by not only women in general, but furthermore, women who use drugs. And as I was looking at the quotations by Angela, most touched by the one where it speaks of women who use drugs being women first and being human first. And it just goes back and reminds me of the work that we did when we were working on the policy on addressing barriers to reporting sexual offences and domestic violence. I may be focusing on this policy today, but I mean, I need to acknowledge work undertaken also by the presidency in the development of the National Strategic Plan on gender-based violence and femicide, which really wants to advance or seeks to advance a safer society for all women, regardless of color, creed, or whatever society may perceive them to be, because indeed women are women first, regardless of what others may judge their lifestyles to be. So just for a bit of background and context, and maybe outline why this policy was deemed relevant, when I received the brief, I was asked to speak on this policy. And now I see it's also on integrating research into the development of policies and strategies. And based on my preceding speakers, I realize just how much value research may add. And the development of this particular policy back then already, and unfortunately now there's been an advancement in terms of the amount of research that's been undertaken. But at the time we felt that the research, or the data rather, was not a true reflection of the situation within policing, particularly in terms of the barriers that exist for women and for society, because the policy was intended to be gender neutral. But we can't discount the fact that women do go through some challenges within police stations that not all men have to go through. And victims of gender-based violence and sexual offenses are further disadvantaged when they have to go to police stations. So when we did the policy, there was an acknowledgement of the partial picture that data presents. Stats at the time did not provide complete information. It was a sexual offences case. You go to a police station and you declare that you've been raped or you're a victim of gender-based violence. And those stats were not necessarily disaggregated and broken down into categories of crime or victims. So what barriers do really is deny groups of victims access to justice and rights to equality and emergency healthcare. If you think about police stations, you need to realize that they are also, for very many individuals, the entry point to access to services, such as post-exposure prophylaxis, in the instances of sexual offences, to assist with the prevention of either HIV or pregnancy. And victims who experience barriers to reporting may also be referred for help through the police stations. So it really became critical to really understand the context of these barriers that exist and how they actually affect victims that come into police stations. So when we look at these barriers, firstly, the policy, I think if I'm honest with myself, the true reflection that it may have been specific when we spoke to victims who are vulnerable. It may not have been specific or fully considered the risk of women who use drugs. However, there was a consideration for women who are in conflict with the law, particularly women who are also sex workers. At the time, obviously, because of the intention of the policy being gender neutral, it would be women, men, young, old, but we must highlight, for the purposes of today's discussion, and really because it's really needed, that women are always found to be in a lesser positive space when it comes to reporting sexual offences and gender-based violence. So the barriers also contribute to an increase in crime. So if women cannot, and I'm speaking to women who use drugs, if they are not able to go and report a crime against them, this means that they then become vulnerable to repeat victimization. So they're not just victims once, they can be victims over and over again. And each time that, and as I think the Deputy Minister said as well, that something gets taken away from them, even though they give. So every time something gets taken away from them over and over again, they feel like lesser and lesser of a human being and have lesser and lesser of a voice. And I can't imagine what that must feel like. So poor treatment at the time of reporting a case may damage relations between the South African police services as well as community relations, which may deter future reporting. This would then mean that the stats that are presented to us are not an actual reflection of what is actually happening in society and on the ground. Central to the development of this policy was the understanding of the framework when thinking about barriers that exist. So when we speak of barriers, we speak about how the hindrances that stop people from going to police stations and reporting crimes of sexual violence and gender-based violence, or sexual offenses and gender-based violence. And these can be thought of both from a structural perspective, which in part can be addressed by the South African Police Services, but some of them also, in which we need to really come to understand, are the ones that are about the individual themselves. So already people are dealing, and individuals or women who use drugs in this context are dealing with the fear of not being believed. So you've not only just become a victim of horrendous crime, but you now have to deal with the fact that you may not be believed when you get to a police station. You may be blamed when you get to a police station and told that, and you know, the shall I say, the theme of this webinar being, were you really raped or did you not get paid? It rings so true for many women who use drugs, because, and I think there was also another quotation or a real lived experience that says a woman was told, were you really raped or did you not get paid? And then you have to go and deal with that from an individual basis. Then you have to deal with the anxiety and the fears from a relational basis. How are people going to treat you? How are people going to perceive you? And how will you then interact again with the abuser? And depending on the member or the kind of person they are within society, the response you may get even from family, you know. So some in a married woman context or in homes, is the fear of destabilizing families. You may have in-laws, you may have extended family that firstly also do not believe you, but also would then blame you based on a lifestyle that you choose for yourself. But then there's also the fear of losing economic support. So you go and you report this to a police station, and you may lose your livelihood even though you've been violated. So there's continuously the fear of repeat victimization, which in all essence cannot be avoided. Then there's also the framework of thinking about barriers from a juridical context. So if juridical context, where the justice system may fail you, where the justice system may just find you to not be a victim and dictate to you what role you play in the act of violence or violation against you, where the thought of going to court and having to relive the experience becomes a barrier and stops one from then going to report an offense or crime of sexual offense or gender-based violence. We then also think about the socio-cultural barriers. And this may differ from community to community and from culture to culture. And if you are from a rural community, then it might not even be dealt with from a police station perspective. And so how do we address these issues where you may have to go to deal and report this to a chieftaincy that is made up of men as a, shall I say, committee? And you have to then say, I have been violated in such and such a manner by another man. And it could be a woman, but most lived experiences in the smaller communities would be by another man. How do you go and stand in front of other men and report that you have been violated and you are now saying you want to see justice in some form or the other? And then we also look at physical barriers. These barriers really speak to structure. It could be about the location of services, where women who use drugs might be in the city center. How far is the police station? How accessible is the police station? How much, even in the rural villages or the geographical areas where transport and transport services are not necessarily accessible, what does that mean for women who use drugs and who have been violated and also need to deal with issues of, I can't even report this because it is just economically not viable, it's geographically not possible, the access does not exist. Then we might even have to deal with procedural barriers. And this speaks to the flexibility of services. Do you have access to services? Where are services based? Are they friendly to people who are not only using drugs, but perhaps living with disabilities as well? This disability might be in the form of the design of a station. Does it have access to wheelchairs? But what if a victim is also deaf or mute? And how do you then communicate? So there are a number of barriers that exist over and above just society's perception against women who use drugs. And these include the attitude towards victims of crimes, particularly sexual offenses and gender-based violence, but also that blaming and disbelieving towards victims purely based on the fact that they are also users of drugs. So then the objectives of the policy were really derived from Section 62 of the Sexual Offences and Related Matters Act, which is also based really on four key principles. Firstly, victim-centered approach. Now, when you speak from a policy perspective and you speak about victim-centered, it needs to firstly speak to the space in which they report. It's so difficult for just any woman to go and report sexual offense or gender-based violence against them, walk into a police station at the CSC, the Client Service Center, just to report. But a woman who uses drugs walks in there already feeling like they are being re-victimized, and it's already a heavy task to just think about reporting crime. So when we're victim-centered, we need to consider these things. Within police stations, there's the requirement for victim-friendly rooms where you can sit in private with a well-trained official who can then assist you in the process of opening a case and with that really take you through the entire process of seeing and receiving justice. So it needs to be a multidisciplinary approach. You know, victims of sexual offenses and gender-based violence need other services, and I've spoken to how the police services are the access and an entry point to other services within the state, and also by non-governmental organizations, access to counseling, access to health facilities and the likes. It needs to also consider specialized services, and it must be principled on an equal but also equitable access to service. So drawing on these objectives from the SOMA, the Sexual Offences and Related Matters Act, as well as the National Policy Framework on Sexual Offences, the three objectives of this policy was to really establish uniform norms, standards, and mechanisms for the coordination and implementation of the SOMA, as well as the Domestic Violence Act, to develop and strengthen coordinated services. So victims must be able to feel like they've walked into a one-stop shop, and services must constantly be consistently professional and mindful of the needs of the victims and the feelings of the victims. And also, lastly, provide resources for the effective implementation of the Act, the National Policy Framework, as well as the Domestic Violence Act. So just to speak to the key principles or what policy really needs to consider when dealing with these issues of society as a whole. And for me, having heard the speakers that spoke before me, it's really key also for women who use drugs and really victims who are in conflict with the law to always feel like their well-being, their safety, and their security is well considered and promoted. And so this is a key principle flowing out of the policy. But also there's a need to promote, and I've spoken to some of these, but it just highlights a need to promote equality of access and availability of services that address a range of diversity represented by possible service users. So we don't have just one kind of individual who requires a service from the police. This will then ensure that victims have access to appropriate services and that a range of support options are available. And some of these support options, or needs rather, have been highlighted by speakers before me. So we need to take into account particular access needs of victims affected by intersecting forms of discrimination. It needs to ensure that service providers are skilled, that they are not only gender sensitive, but sensitive as a whole to the needs, and also just value and appreciate the individuality of people that walk in requiring services. If we want to realize indeed the vision of 2030, where we reduce levels of crime, and it would require a range of interventions that are not a one glove fit all. And we need to also realize that our clients are not the same. So the shoe fit will not fit for each foot. We need to have ongoing training, and this is a key thing, a key recommendation that came out of the policy: the training on sensitivity, training on just working with individuals and victims of crime, regardless of personal perceptions. Training and conducting work in accordance with clear norms and standards. So once we know that these are the standards of practice, then we know how to conduct ourselves in carrying out our duties as a police service. But key to ensuring implementation and successful implementation of policy is the monitoring and the evaluation of services provided. It's been said over and over again that our biggest failure is not the development of policy, but rather the implementation thereof. So we can have wonderful policy that has been developed, but if we fail in implementation and in training for implementation, then we would not have achieved a thing, because the intention at the end of the day is to not have a beautiful document that sits there, but to really have impact, that whatever work we do must be felt at the most localized levels of society for all individuals within those societies and communities. So the principle also of the policy was to reject the ideologies that excuse and justify victim blaming. A victim is a victim. No one ever asks to be violated in any way, and they're, especially because their lives are not intended to disrupt those of others. It shouldn't be justified when others disrupt. So in terms of the final principle, is really speaking to comprehensive information about all processes and options that exist within the justice system, starting from the entry point, which is the police services, in a manner which is non-judgmental, which is appropriate, which is clear and sensitive to the needs of the victims. The thing here is that the victim remains the client. And so this was really the key principles that informed and guided the development of the policy, in obviously in conjunction with consideration to the national strategic framework, as well as the Sexual Offences Related Matters Act, as well as the Domestic Violence Act. I've spoken a little bit to the NSP, which is the National Strategic Plan, and I think it would be great in upcoming webinars to really explore the links between the National Strategic Plan and the work that's undertaken to address the needs of women, and by extension, women who use drugs, but also in terms of moving towards policy implementation. We need to also consider the implementation of integrated crime and violence prevention strategy, which looks at the 6 pillars, namely victim support, safety through environmental design, intervention, speaking to effective and restorative justice system, and really all-encompassing issues that relate to safety and security, and bringing together all relevant stakeholders. I think policy development can no longer be done in isolation. There are a number of role players, just based on today's webinar, that need to come to the party. And when we start to implement policies and strategies such as the integrated crime and violence prevention strategy, perhaps we can start moving in a direction that seeks solutions as opposed to just discussion around key matters that affect the lives of real people. With that, I thank you.
Thank you very much, Ms. Masisela. Thank you very much for a policy that's, really looks at recognizing barriers, that is experienced by persons reporting offences, but also a policy that provides a very holistic, relevant response to the delivery of services. So thus far, the presentations have demonstrated that research and policy provides the guidance to promoting a very systemic approach towards integrated interventions in this area. And as indicated, today's presentations are segmented into two thematic areas. So we move now from research and strategies and policies that generally inform and provide a framework for interventions to now exploring two key interventions that exist within the sectors of the police and the prosecuting authority. So I now introduce to you the first speaker for this segment on interventions, who is Colonel Rifhelwe Matlamele. She's a section commander for substance abuse programs within South Africa, South Africa's police service, and she's based at the Division Visible Policing. She was the Provincial Social Crime Prevention Commander in Limpopo for 15 years. In 2015, she was appointed as a section commander for domestic violence in the Division Visible Policing. And from August 2017 to date, she was restructured to be a section commander for substance abuse programs, which was a newly established subsection in SAPS. She played a critical role by representing SAPS at various social crime prevention forums. She has 33 years experience in the South African Police Service and spearheaded that SAPS enters into a working collaboration with the University of Pretoria to address harm reduction. Colonel Matlamele was crowned SAPS Woman of the Year in 2014 for the Limpopo province for the sterling work she was doing to ensure that the vulnerable groups in Limpopo are educated about all legislation governing their safety and protection. I now hand over to Colonel Matlamele. Thank you, Colonel Matlamele. Over to you.
Good morning, Deputy Minister. Thank you, Deputy Minister, the organizers and all delegation present. I would like to speak about SAPS as one of the law enforcement agencies is responsible for the implementation of policy responsibilities included in the National Drug Master Plan, and have developed its own departmental drug master plan in this regard, which includes focus on supply reduction through police actions to combat drug trafficking and enhance compliance with the liquor legislation. This action is implemented by curbing of the production and distribution of such substances through intelligence-driven operations, harmonization and enforcement of laws and policies to facilitate the effective governance of the alcohol and drug supply chain. SAPS also plays a supporting role in respect of demand reduction, which focuses mainly on social crime prevention by implementing integrated community awareness and public education interventions through its community policing forums, victim empowerment programs, youth-based crime prevention programs, and safer school programs. The lead in this intervention is the Department of Social Development. Understanding the impact of criminalization, stigmatization, and discrimination faced by the marginalized group populations is a critical part of being able to work with all groups of the community. This can empower law enforcement agencies, especially SAPS, because we are the entry point to the criminal justice system to fulfill their given mandate, while holding the constitutional principles that should be inherent in their daily life functions. The way law enforcement officials interact with communities have wide-ranging implications for the broader society.
Sorry to interrupt, Colonel. Do you want to project your presentation? We don't see it on the screen at the moment.
Yes, I will appreciate it. So as everyone can see it.
Okay, great. So Obukeng will actually start projecting the presentation, sharing that presentation.
Yes, thank you so much, Chairperson. The way law enforcement officials interact with communities have wide-ranging implications for the broader society. These interactions influence community relationships, social cohesion, and human rights, and ultimately can reinforce or increase the cycle of violence. Police can reduce or increase stigma and discrimination faced by the marginalized groups, including women who use drugs, through the way they treat them on a daily basis. Communities rely on police for safety and protection, but there are pockets within the police of allegations of abuse of power leveled against the police. This highlights the need for integrated community dialogues, public engagements, policy review, and action that can make police protection a reality and a home for the community, including the most vulnerable groups. Police are required by the South African Constitution and the South African Police Service Code of Conduct to treat all people fairly, regardless of race, gender, ethnicity, national origin, sexual orientation, or religion. But in reality, many sex workers, as well as people who use drugs, LGBTQIQ+ communities, because they are faced with the reality of stigma, discrimination, and abuse on a daily basis. During 2019, we came up with a solution to address all these identified gaps. During 2019, we as the South African Police Service and the stakeholders, we established a National Drugs and Anti-Gang Forum, which is a multi-sectoral group to address demand and harm reduction. The team drafted a National Drugs and Anti-Gangsterism Forum, terms of reference, and an implementation plan as outlined in the National Drug Master Plan, to give clear guidance to police, key departments, civil society organizations, and other interested parties, platforms to address the scourge. To remove the current policy clash between policy that recognizes the need for harm reduction services and the challenges of expecting law enforcement to enact laws related to personal possession. The forum will ultimately enable law enforcement to refer people to other services and free up time and resources to focus on violent and priority crimes, which is organized crime and drug trafficking. It will assess the current response to safety, disorder, and health-related problems, especially what is expected from the police when dealing with drug abuse within communities. In order to improve policing of drugs and gangsterism affecting the vulnerable groups, a SAPS learning program is being developed to empower and capacitate service members. The primary target for this learning program will be crime prevention units at station level, as well as the established anti-gang units. The process is informed by the anti-gangsterism strategy of government. I would like also to give you my personal experience, Chairperson, and before I close up my presentation. During 2016, my mom passed on. It was a thing of that, you see, if ever our parents, especially our African communities, they don't draw up wills. So that was the time when I have seen that we as women, if ever there is anything, we are not fully protected. My mom passed on 2016. Fortunately enough, my mom passed on, her age was 91 years. 30 years ago, she wrote a will. She drew up a will whereby she nominated me and my late sister. It was a thing of my brothers didn't want us as women to inherit anything because they are men and they are responsible to be leaders in our family. I was taken up to the local traditional court whereby I should start from scratch. Why did my mom nominated us as women because we don't have a voice? So the challenges that Angela and all the rest as women are facing, it is real. So fortunate enough for me, because I was responsible for domestic violence and had all policies with me. It was the policies, the constitution, I had all the documents. Then I had to educate the whole traditional court, how PEPUDA works. So it was a thing of that the court, my court started from 8 o'clock in the morning and it was closed at 6 o'clock in the afternoon because I had to educate them that as women, we've got rights. So fortunate enough, because I put in policies there, my case, their cases were thrown out and I won. So imagine for a person who doesn't have access to policies, what is happening to them. That's why I'm saying that we as stakeholders, we need to fight. We are their voices. We are the voices of the voiceless. Thank you so much. Thank you.
Thank you so much for that, Colonel. We can see that you sincerely believe in ensuring the voices of women who are vulnerable, their voices are heard. And thanks also for sharing your personal experience. Indeed, you really are empathic and able to take cognizance of women and their vulnerability. But I think importantly, in your presentation, you were able to recognize the importance of integrating community dialogues with vulnerable groups, the importance of bringing together police and community members to ensuring that sensitized service delivery measures are brought to the fore. And looking at how further harm reduction services can be provided, but also looking at that it's important to ensure the harmonization between policy and service delivery. So thank you very much for that. We now hand over to our next speaker, Advocate Pierre Smith. He is the current acting Special Director of Public Prosecutions of the Specialized Unit in the NPA Head Office for Sexual Offences and Community Affairs. He has extensive experience and expertise in this field for the past 30 years, including prosecution of several related cases to this area, but also involved in specific legislative drafting, research and training and development. He is an international speaker at he was an international speaker at several high-level events. I now hand over to Advocate Smith. Thank you, Advocate. Over to you.
Thank you, Dr. Naidu. I hope that colleagues can actually see the presentation that I've added on. Is it visible?
It is visible. Thank you.
Thank you, Dr. Naidu. First of all, I would just like to acknowledge the wonderful overview and presentation by the Honourable Deputy Minister. Much appreciated. And also much appreciated to Ms. Juldesh Akashiwa for your overview. And of course, Dr. Naidu, we are colleagues on another level as well, specifically talking about the National Strategic Plan on Gender-Based Violence and Femicide. Also to my preceding speakers, in addition to the Honourable Minister, Ms. Angela McBride, wonderful presentation. I really enjoyed it. However, it is shocking to the bone, but crucial for us to know that information. Ms. Lillian Mashele, I'm specifically going to utilize some of the points that you raised in your presentation because it obviously tie up with some of my pointers as well. And then my police counterpart, Colonel Matlamela, much appreciated. So, colleagues, I will proceed in relation to my presentation to the next slide, which will be, let me just get the process. Let me just unmute. There we go. Of course, we all know that providing justice to all vulnerable groups who are affected by gender-based violence and femicide at this moment is a specific government priority. What I specifically appreciated from the research was what was summarized on page 1 of the executive summary after the Roman numerals, where it was stated as follows. Culturally embedded power imbalances that exist between men and women around the world often leave women exposed to increased stigma, abuse, violation, and coercion. This is crucial because I think it sets the tone of the essential function of this research being done, and also for the presentations that were presented so far. Now, we all know that in the criminal justice sector, the core function of the National Prosecuting Authority is, of course, prosecution. Hence, it's reactive in its nature, because that's the focus and the core of the criminal justice sector. And I will talk about that a little bit later. Social context awareness training of key stakeholders in the work that we do, and specifically in relation to the advanced training courses for prosecutors and the integrated training format for stakeholders, which is in line with Section 66 of Act 32 of 2007, not 2207, pardon the typo. The Prevention and Combating of Trafficking in Persons Act plays a crucial role, and it was specifically mentioned by the Honourable Deputy Minister as well, where we talk about specifically issues in relation to sex workers, drug trafficking, and them being exploited for sexual exploitation in relation to trafficking in that regard. Now, that is a crucial point just to flag for purposes of taking the conversation further. The NPO has got a particular focus on gender-based violence and femicide, which is a national priority for all our divisions. We work very closely with the Department of Justice in line with the establishment of designated sexual offences specialised courts in line with Section 55A of the said piece of legislation, Act 32 of 2007. Of course, that's why I specifically raised it here. A current challenge would be that we still have constrained re-specialization specifically in this field due to the fact that we do not have enough of these prosecutors specializing in this. And this is an ongoing battle. We are working in relation to a recruitment process for more of these prosecutors to be appointed, because you need to have a particular skill. You need to have a particular understanding of social context awareness training. You need to have a particular attitude. Your social cultural focus must be absolutely in line with dealing with these cases. So that's why it's essential for us, when we do appoint these prosecutors, to expose them to an extensive advanced training program in this regard. Then this is the point that I've specifically flagged, because I think it's crucial to put it into perspective. That however, when I said that the criminal justice sector, and specifically National Prosecuting Authority, is reactive in its nature, we do have a proactive responsibility as well. And this is when we started to do specifically in relation to when we started with particular, let me just go back, when we started with particular public awareness or outreach programs in this regard, because it's crucial for the community to have an understanding about the work that the NPA is doing, but also to make them aware of what it actually entails and what we should do, but also for us as the prosecution to have a good understanding about what the challenges are out there. And sometimes there's that, let's call it like a barrier between us and the community needs and the community challenges and the community questions, which we should overcome. This is why it's a responsibility of all our Thuthuzela care centers, and there are 55 currently, to have specific outreach programs on a regular basis. If I go to the next slide, this is just to add on to the TCC model. I'm sure colleagues are well acquainted with it. It's a one-stop integrated rape care management model. I'm not going to go into too much detail about that because I want to focus on other additional pointers. The focus of it is victim-centered, court-directed with prosecutor-guided investigations and stakeholder cooperation. Now, this is where these TCCs deal with all victims, irrespective of what the matters are that they come to report, as long as it's in line with gender-based violence femicide. And at this stage, we deal with about, as I said there, approximately 90% of all matters reported on sexual offences. The questioning part, or maybe rather put it more specifically, a concern is that if you look at the matters that are being reported and you put that into a balance between children versus adults, 57% of reported at present at these sites are with children as victims. Between 2015-2016 financial year to the 2019-20 financial year, we assisted 169,025 of these victims. Yes, of course, the question might be, we only have 55 of these sites. A far cry short, for instance, of the police's FCS units, where they have 176. So we need to strive to get to a process where we will be able to have more sites available to sort of like expand that specific service delivery to all victims. Then, when I spoke about vulnerable groups, in this regard, we've picked up, and I will talk about the criteria of new sites to be identified as well. It is quite clear, as the previous speakers also alluded to, specifically the Honourable Deputy Minister, that we know that in many instances, women are specifically exploited as drug moles, inter alia, because of many reasons, and they're being exposed to their vulnerability. And then, of course, it will have an emotional, physical, psychological, financial, inter alia impact on them and on society and on their children or family members as well. Now, if we look at, for instance, and I just need to go back to the previous one, if you look at the fourth bottom bullet from the top, where I said that at the present stage, we're in a process of identifying 6 more sites to be established nationally. One of the criteria points is specifically if a particular area is particularly prone to gangsterism or drug abuse. That is a crucial question to be answered for the simple reason that we've picked up, and the research has confirmed, that there's a direct link between a high rate of drug abuse, gangsterism, and unfortunate victims of gender-based violence or sexual offences per se. So that for us is a crucial pattern to pick up in a particular area, because then we know that service is even more so required in that particular area or jurisdiction or division. Now, currently, there are also specific amendments to relevant legislation. We refer to it in our lingo in the criminal justice sector as the GBV bills. It's first of all the Criminal Law and Related Matters Amendment Act, which is the main criminal procedure act that guides all criminal procedure in court, so to speak. And in this regard, there's a whole process that have been implemented in relation to bail, specifically for alleged offenders. We're talking about the Domestic Violence Amendment Bill, where we really look at the whole process to have a better protection of women, specifically in relation to protection orders, the process of interim protection orders, and so forth. The Criminal Law, Sexual Offences and Related Matters Amendment Act that my previous 2 speakers also referred to. That regard, we're specifically looking at the National Register of Offenders to open it, because currently there's a bit of a lacuna in the legislation, because it only provides for people that have been found guilty or convicted on offences against children or disabled people that will be included in this list. We now said it should be open to everybody. In other words, irrespective of who the unfortunate victim was or who the victims are, that alleged offender, or when he was an accused and convicted, his or her details should be included in that register. And there's also the Victim Support Services Bill developed by Department of Social Development. And I think it's crucial just to note that we are a crucial stakeholder in all of these processes, because we play and we provided extensive inputs in the development of these aforementioned bills. Now, I want to come back to the pointers that Ms. Lillian Mashele specifically raised in relation to the social context awareness training, which for us is a very crucial aspect, and it ties up about how are the prosecutors relating to victims of these offenses, and specifically also if drug or woman who uses drugs also played a particular role in this regard. It's critical for us to have an excellent understanding in this sector. What are the barriers in relation to reporting? What are the causes for those barriers, and what are the solutions to circumvent those barriers, because it's surmountable, and how can we actually directly address it accordingly? Attitudinal is a huge challenge for us, and I'll be upfront to state from the onset that we have prosecutors that have got massive attitudes in relation to dealing with these type of offenses. So that will not be your ideal person to deal specifically with gender-based violence related offenses and femicide matters, and also then the unfortunate victims of these offenses. Social cultural barriers is a huge barrier, because in many instances it's a lack of understanding, as they say, the lack of knowledge in many instances cause a fear for us to react to it accordingly. Procedural challenges in the criminal justice sector is in many instances a huge process of misunderstanding for people. This is where we also have the court preparation officers that plays an essential role, which is sort of like your bridge between your prosecutor and the court process, to explain in detail court processes to your victims or whoever the witnesses are that are to testify in a court environment. We've got also in the legislation, specifically court procedure protection measures. We're talking about section 178, 174, 158. You're talking about CCTV system. You're talking about all of that processes that can be utilized as well. So for that focus, there are those protection measures, but it's essential that prosecutors and our colleagues in SAPS too are on the same page in addressing these focus area and our responses to that. To prevent secondary victimization for obvious reasons. All of this said, we do all of this to ensure a specifically targeted victim-centered approach, irrespective of what the circumstances are of the victims that are reporting these offenses. It's very crucial for us to have the right people to deal with these type of matters so that you get that absolute service delivery at the end, and also that your systems are in place by all the relevant departments. So just to add on, ongoing continuous training in my field of expertise, specifically for the prosecution, is an immensely crucial focus. Because as we know, the law is a constant developing science. I mean, what's in today might be out tomorrow. What's law today might be changed tomorrow in a different faction on how the law is to be interpreted and applied. Of course, we sit with excellent pieces of legislation. Many a times, as one would know if one reads all the legislation and judgments on it, that in some instances another stumbling block would be the application and interpretation of legislation. So in other words, there we include that also in our training to ensure that people will know exactly how that should be interpreted to ensure ultimate service delivery to our victims. So in a nutshell, as I said right at the end, the NPA is obviously, with reference to the implementation of these bills, committed to ensure that it will be implemented to ensure a victim-centric approach to its ultimate best facility. But as our stakeholders also specifically said, and our previous speakers, pardon, that a collective approach as a united front for us as stakeholders in this field is more than essential. If we do not stand together and address this collectively from A to Z, so to speak, we are not going to succeed. It is immensely essential to spread that message that we hold hands, that we are on the same page, that we are there for our victims to ensure that irrespective of the circumstances, we will do our absolute utmost best to ensure that a victim-centric approach will be cast in stone and will be treated with the golden focus it should receive. Thank you, colleagues. I hope I gave justice to the NPA focus in this regard. Much appreciated. Thank you, colleagues. Thanks, Dr. Naidoo.
Thank you very much, Advocate, for very clearly articulating the scope and capabilities of the NPA, but also in particular providing a perspective of the gaps and challenges that need to be proactively addressed in relation to women who use drugs. I mean, it's very important to always take cognizance, of those challenges, and you've done justice to that. So having said that, in conclusion, it's clear that discrimination and stigma against people who use drugs exist, and there is a need to strengthen our shared efforts to recognize and address the unique needs of women living with drugs. We have the research, we have the policy, and like Advocate Smith mentioned, the legislation and the interventions, all of which needs to be adequately consolidated to best meet these unique needs as presented by Ms. McBride. With that, we move into the next part of the session to focus on the questions and answers. And we have a few questions from our registered participants that I feel we need to give a space to address. And one of the first questions that I would like to pose, and perhaps Ms. McBride can answer this one, why is this the title of the webinar? So Angela McBride, over to you. The question is, why is this the title of the webinar?
So the reason why this is the title of the webinar is because this is the title of the report. There were 2 reports that were written up based on the consultation groups, one of which was a detailed description of the process, methodology, as well as outcomes, and the other was direct quotes, which we formed with the help from people from Sandport as well as the community, taking just the quotations, just the raw information that was put forward, and that made up a separate report called In Our Own Words, We Were Raped. So ultimately, were you really raped, or did you just not get paid, is a quote from one of the women who joined our consultation groups.
Wonderful. Thank you so much, Angela. Next question that was posed to the panelist is the fact, and maybe we can, Advocate Smith, maybe you can actually address this particular question. Is the fact that a woman was under the influence of drugs an impediment for her evidence to be accepted on a charge of rape in a court of law? Over to you, Advocate Smith.
Thank you, Dr. Naidoo. It's a good question. Remember, specifically in relation to sexual offences, one needs to remember that you're dealing in many, many, many instances. Most of these cases, and I'm going to talk from that angle on GBVF, you deal with a single witness. So in many instances, as we talk in the process of law, that should be a credible witness. In other words, it's crucially essential that the witness is being exposed to a thorough consultation by the prosecutor to ensure that that witness will deliver that top-notch testimony in court, in chief already. In other words, when she delivers her testimony in court, even before cross-examination. What we usually do, and this is what we do when we train our prosecutors, because when you are doing your preparations, you know what the possible cross-examination questions will be, because you know what the likelihood of defense will be. Because in many of these cases, you're sitting with 2 main defense arguments. It's either identity is placed under question or consent. So depending on the type of question that will be placed under cross-examination, you will know how to elicit the information or the testimony from your main witness to ensure that you cover the possible cross-examination questions on consent and or identity. Now, yes, it's very crucial to, if a witness has been exposed to any form of substance abuse during the period of the alleged sexual offense, that is clearly stated in court, because it doesn't serve any purpose if it comes out later cross-examination or even after that as a coincidence, because that might influence the credibility of the testimony of that particular witness. But it doesn't mean, and that is the crucial part that people must understand, that if you've been exposed to any form of substance abuse, that alone is a predicament for your delivery of your testimony. I mean, I've dealt with many of these cases where people were under the influence of whatever substance abuse, and they were still excellent witnesses in court because they could reveal and explain to the T what happened. The point is, prior consultation from the prosecutor with that witness, absolutely essential. Secondly, the other point that's crucial is that when you have prosecutor-guided investigations, the policeman or police official works closely with the prosecutor. For them, it is to see what evidence do I have in place to cover the elements of each of those offenses, so that you don't have an issue that there's some of the elements are not going to be covered, because that's another crucial part. So for instance, corroboration or circumstantial evidence, for instance, forensic medical examination or J88 is a crucial part of evidence to support or to substantiate or to corroborate the evidence of your witness or your unfortunate victim in this regard. Obviously, depending on when the incident happened versus when she or he was exposed to a forensic medical examination. So in a nutshell, the mere fact that the person has been exposed or was under the influence of a substance abuse alone cannot be alone standing a predicament. It must be seen in the context, or as we say, in the merits of all the facts placed before the court to determine the credibility of that witness or not. Thank you. I hope my response is clear. Thank you.
Thank you very much, Advocate. That was very comprehensive and yes, very thorough. The next comment and question as well is in the chat, and I'm going to ask maybe Colonel Matamela to respond to it. The response is, the police should be instructed to register charges of assault when women wish to lay a criminal charge, and not only refer them to approach the courts for protection orders. It often happens that women have to wait until the following day to approach the courts, which means they have to return to the house where the abuser is. So, Colonel Matamela, your response on that?
Yeah, thank you, Advocate. Whenever a case, what is it? The applicant of a protection order has got the right to open either a criminal case or a. It's two things that the person can do. Immediately after that, then the police can take action if there is a case that is registered. The issue of applying for protection order and coming up the second day doesn't stop the police from opening a case. It depends on what the applicant wants and needs. And I think because I've got my colleague here from NPA, he can also, Mr. Pierre Smith, can also allude to that. Thank you.
Thank you so much, Colonel. And then a question to Ms. Lillian Mashela. How can we strengthen, and I know you've spoken to this, how can we strengthen an integrated approach and stop working in silos? I know it requires a very in-depth question, but yeah, maybe you can actually very briefly tackle it. Thank you, Lillian.
Thank you. So it is, it does require some in-depth thinking, but I also think this is something that also needs to start at a, shall I say, strategic level and needs to be supported even from a political level. And I want to make an example of the white paper. See, so what departments have to do is that they also need to satisfy their own deliverables and their own APPs. And so when one department is working on a target, it's not necessarily a priority for other departments. So what is key is firstly considering or working collectively in terms of the planning. So joint planning, I would think, is crucial, and ensuring that there's synergy in the work that we undertake and aligning, in fact, all the work that we do to ensure, in fact, and contribute to, shall I say, lowering the misuse of resources. There are several, DSD would be working on a project that's linked to what the police are working on, that's linked to what the NPA is working on, and you find that there's duplication, not only of work, but duplication of resources. So I think if we plan together, we can then start to assign resources smartly. And this is all, it all also speaks to evidence-based planning. It needs to, so when we plan, our interventions need to be informed by evidence. We don't just plan for challenges that we need to address as and when we go, but it needs to be informed by some sort of data that says, perhaps as at a strategic level, this is the challenges that we're facing, and to ensure that we circumvent and we are proactive in dealing with issues, we need to pull together towards a joint and a shared vision. And I mean, government tries to do that, through the NDP and pulling together and ensuring that it sets the vision. But so how do we then plan together to ensure that we all drive towards attaining that same vision? And if I may, I know Colonel Matamela responded to the question, but I'd just also like to speak, and I must actually appreciate Colonel Matamela, who worked with us in the development of the barriers policy. I'd like to also contribute to the previous question in terms of a response, because part of the objectives of the policy was to move or create a shift from the performance targets of reducing sexual offences or the reporting of sexual offences by 4 to 7%, because the intention really, if we're saying that as the police or the justice system, if we're saying we're effective, we need to see an increase. That would then be a reflection of the levels of trust that communities have in, firstly, the police and the justice system as a whole. So the reduction then contributes to the cases that the police would then take. Remember, they are incentivized based on these reductions. So the more cases come, the easier it is, if we're saying, to manipulate stats. And I'm not saying this is the standard practice across the board, because there are really some exemplary individuals within the system. But there are also stations that are target driven. And so if the target is to reduce the reporting by 4 to 7%, then that means we're chasing away victims of crime so that we can receive the necessary incentives or bonuses that come with reduced targets. So that's also something that needs to be considered in terms of setting targets. Sometimes a reflection of an increase in certain crimes is actually a reflection of work that's been undertaken and the trust that communities have within the police. I hope that somewhat covers everything. I'm not as detailed as Advocate Pierre.
Great response. Thank you so much. It's a very comprehensive response. Thank you for that. And I see a last response coming from Unova Linda. She's raised her hand. Unova, do you want to actually respond? I know we've covered your question, but is there anything else that you would like to say? Over to you. Unova, you need to unmute yourself. Yeah, great.
Do you hear me?
Yes, we can. Thank you.
Yeah. Yes, muted my mic. Yes, I'm Linda Unova, and I'm a senior magistrate in the Cape, in the Office of the Chief Magistrate. I'm affiliated to the Family Court, and in response to Colonel Matlamela's response to my
I'm sorry, Linda, we keep losing you.
Criminal cases. It is indeed correct, Colonel, that the victim has the choice whether to lay a criminal charge or to approach the court for a protection order. That should be the choice of the victim and not the decision by the police officer. We experience this in our courts on a daily basis, where abuse, which in most cases takes place over weekend, and in most cases where there were maybe in certain cases an abuse of alcohol or drugs, and where women approach the police for protection. The mere fact that a woman has approached the police is an indication that she needs the protection from the police. If she thought that the abuse is not as serious and that she can wait for the Monday or the next day to come to court, then she would not have or approached the police for protection. The police has almost have a blanket rule. If a woman arrives at the police station requesting and complaining about abuse, she is referred to the court of protection order. That should not. Woman is indicating the protection of the police. There is nothing wrong to have a protection order as well as laying a criminal complaint of assault or whatever the crime.
Thank you, Linda. Colonel, do you want to add to that?
Thank you. I'm so happy to see the magistrate here. The issue that we are having a problem with is when it comes to complainants that come to report cases of domestic violence at our police stations during weekends. That's where challenges are, because there is nowhere where we can just issue a protection. They need it must be signed by the magistrates, it must be, or the clerk of the court, before it can be a valid document. So I think if ever we can maybe form something so as people can be assisted 24/7. Maybe there at the court, that some people be designated to be able to work with us in assisting the communities. Because I can give an example of last month where due to this COVID-19, this lady from the magisterial area of Pretoria North had to go, went there to apply for a protection order because the husband, so and so, was abusing her and the kids, 17-year-old. So now I had to be phoned. Then my friend asked me, Matlamela, I went to Pretoria North, and then when I arrived there was a COVID. Then they refer me to another place where they said, no, the magisterial area, that place doesn't fall within the court jurisdiction of us. So now it was a thing of my friend taking the law into herself by saying, no, I'm going to that man with all assortment of instruments to be able to rescue those, because we couldn't do anything because she was being told to go this and that, and she was referred from these places and that places. I think people need to be educated, because if ever communities are not educated, I know like this and the other one knows the law to work like that. So now the communities out there at the grass, they are being victimized, secondary victimized. And I'm very happy to see Magistrate Linda here. Thank you.
Thank you so much, Colonel Matamela. Colleagues, thank you for those questions, and to the panelists, thank you for your well-tackled responses. I now want to hand over to Ms. Akisheva to provide the concluding remarks and the next steps in this process. Over to you, Ms. Akisheva. Thank you.
Thank you very much, Linda. It's always difficult to come up with the concluding remarks because of the discussion that we have. But first of all, I believe it was a very good opportunity for us all to engage in a very open discussion, especially among the SANPUD or drug users, women who use drugs, with the critical service providers, those who represent social services, police, law enforcement, and justice services that are expected to be provided to the victims of violence, and especially to the women who use drugs. I think what really is coming up very strongly through this discussion is not any longer us and them, right? It's not any longer that we have national authorities or civil society organizations who are standing against each other and trying to accuse each other rather than trying to find a solution. I really appreciate the very constructive discussions that we had in this regard. In a way, some issues that are coming out of the discussion are quite generic. As you know, DC, we see the same issues coming from different meetings and from different discussion. And that is clearly an issue of how to make sure that the excellent pieces of legislation, as mentioned by Advocate Smith, that is available in South Africa, in legislative areas, but how to make sure that these pieces of legislation are being implemented. They're properly interpreted, they're implemented in a very integrated manner. How to ensure that there is interagency cooperation among different service providers with specific targeted focus to different groups of people who are in need of that assistance. So it seems that what was coming also as a discussion, the different services, they also have their own challenges, right? It's also capacity gaps. It's maybe a lack of knowledge, lack of specific skill set, and also attitude to deal with this type of issues. Clearly, there is some policy gaps, right? As mentioned by the police, and it was just really very crucial, the policy gap between them performing a law enforcement functions as relates to the drug possession, at the same time respecting and supporting the harm reduction services. So all these inconsistencies in the legislation and policy and implementation of this needs to be addressed in a coherent manner. What next, right? We will continue working with the Sun, Angela, with women who use drugs, to see how we can follow up on the specific challenges that are being identified through the discussion and also through the needs assessment. How we can bring all the dots together to make sure that there is a consistent approach in addressing these challenges. This is the first webinar in a series of the webinars that we are planning to organize in that regard. Please stay tuned with us. We will continue reaching out to you, asking for your contribution, asking for your advice, and also asking for your follow-up at your level. Let me conclude by expressing appreciation to our panelists, to our speakers, to Deputy Minister Henrietta Bogopane Zulu for her always sincere and very human focused interventions. Thank you very much for your presentation and for your drive to make sure that what DSD is responsible for has a direct impact to the people that we are working with together. Let me appreciate Advocate Pierre Smith for a very clear presentation on the issue that is he's dealing with under the Thuthuzela centers, and also overall criminal justice response and the gaps that needs to be addressed as well. Thank you very much to Lillian Mashela and Colin Matlamela from the police, South African Police Service. It's usually very difficult for SAPS to really address a lot of questions and come up with the concrete suggestions, because in many cases SAPS is under fire as well. So we really appreciate that you acknowledge the challenges, but you also suggest some constructive approach how to overcome that. So thank you very much, colleagues, and thank you very much all the participants for a very constructive discussion. We hope that we will be able to follow up on that and to come up with some concrete action points. Thank you again. And Angela, if you want also to highlight anything, please, you're welcome to do so. Sorry for putting you on the spot. If not, then let me thank again everybody who participated, and we will continue our work in that direction. Appreciate all your support and continuous engagement. Thank you very much. Bye-bye. Thank you.
Thank you, everyone. Colleagues, perhaps you can put on your camera so we can take a photo of all the panelists. Please put on your camera.
Good to see faces of friends and colleagues.
Indeed, good to see. I agree with that statement. It's good to see you all. Put a
in
face.
Good health and smiling, right?
Absolutely. What can we do? We have to.
Great. Thank you, colleagues. Thank you once again. Thank you, everyone.
Okay. Thank you very much.
Bye-bye.
Bye. Thank you for having us.
Bye-bye.